Making Babies in Your 40s, Episode 8 Questions to Ask Your Fertility Doctor, a Primer. I call this episode a primer not just to give you the knowledge to ask questions, but also to prime you to be bold and ask them in the first place. You often feel that when you are not a doctor and it's not your sphere of expertise, that you can't ask questions. But anyone who is truly knowledgeable as a doctor should be able to answer questions in a way that is jargon-free. It's a sign of competence if your doctor can give you an explanation that you, as a layperson, can understand. A sign of incompetence is relying on jargon to cloak everything you say in a shroud of mystery. So be bold, ask questions. Here are some questions I think are useful to ask your fertility doctor. First, you want to know if your doctor treats patients like you. You want your treatment to be at a clinic which deals with the tip of the iceberg in terms of age and fertility severity. So ask these questions to find a clinic that would be a good fit for you. Number 1, what percentage roughly do you have patients aged 40 and over? 2, have you had a live birth from a patient aged over 40 years? Or at least a pregnancy spanning your handover to a gynecologist for the birth. Second, you want your treatment to be at a clinic which adapts their protocols for older patients. Doctors at these clinics are typically very motivated to consider how protocols adopted universally for the general population fare in the poor prognosis group. They are more likely to scrutinise any new research which has only worked in a younger patient cohort, because that is not their typical patient. So, questions to ask. Do your treatment protocols, the drugs and the cycle milestones change for a 40-year-old? And here I recommend getting really specific, like, do you extract eggs earlier from their follicles, timing-wise? And know why you're asking this question. So research has shown that a 40-year-old may benefit from early triggers at smaller follicle diameters, namely 16 millimeters as opposed to the standard 20 to 22. See my book, page 100, 12 Rules of Making Babies Late, which cites references. So you need to ask your doctor if more research has been done on this, because the area is constantly evolving. You want the latest thinking. 2, ask whether they consider pre-treatment important. Eggs grow 4 months before they appear in your ovaries, so potentially supplements and acupuncture should be discussed. The big thing with older women is keeping those eggs that start out normal all the way through, because the ovarian environment which is aging is suboptimal. 3, ask, do you recommend pre-implantation genetic testing regardless? Now, arguably, it shouldn't be used routinely in the absence of a genetic condition. Even though a greater percentage of older patients' eggs are abnormal, they typically produce very few eggs, and so you do not necessarily want to be taking away a 40-year-old's last chance of pregnancy with her own eggs if it could produce a healthy baby. Remember, abnormal eggs often don't survive culture, and abnormal embryos often result in miscarriage. So there's self-selection going on anyway, and also the ability, of course, to test for abnormalities later in the pregnancy. You want the least interference to your embryo in the laboratory if you can possibly do so. Ask your doctor when it is really recommended. 4, how long do you culture the embryos? So the embryos of older women often do not survive to day 5. Whilst day 5 provides a natural way to self-select embryos, older women are less likely to have a lot of embryos and ones that survive to day 5. A day 3 transfer allows the embryo to grow in the uterus before it implants, as opposed to the laboratory. Third, you want to know about the particular treatments or services that can be offered to you. So ask these questions. Do you have arrangements with a donor egg bank and a donor sperm bank, should I need one down the track? You may also be interested in some of the latest therapies which have achieved some good clinical results. So I would ask, what add-on treatments do you recommend that have clinical success backing them? If a clinic treats the harder cases, then they are likely to be interested in the treatments and research that help this age group. Whilst you may not have access to a clinic that's trialling these more experimental treatments that have shown some measure of success, you want your specialist to keep abreast of developments that impact this age group. Quizzing your potential fertility specialist on things that help patients with low ovarian reserve, even if it's experimental at this stage, will help you make a decision. For example, a treatment in this category is ovarian rejuvenation, reawakening dormant or sleeping follicles, or platelet-rich plasma, PRP, where you inject a fraction of the patient's own blood into their ovaries using ultrasound guidance. It's experimental, meaning investigational with no conclusions, because no large clinical trial results are yet available in statistically significant numbers, but it has reported success in small clinic trials offered at a few clinics. So ask, what do you know about platelet-rich plasma, PRP? Now, the impression is that it's effective in some patients, not all, and in whom, and trying to find out who will benefit is the focus of more and more trials that are being done at small clinics. So ask about the latest research. If a clinic treats the harder cases, they're more likely again to be interested in treatments and research that help this age group. Of course, medicine changes and protocols change, but the underlying rationale that individualized care helps older patients is undeniable. None of what I've said is intended as medical advice. I'm not a doctor. These are questions for doctors, and they provide the up-to-date answers themselves. I've cited sources in my book at page 100 for the reasoning behind asking the different questions you could potentially ask, and the reasoning is subject to change. What is important is to elicit a response from your doctor. He or she should provide you with the latest research and answer. So the purpose of the above is simply to highlight that IVF for a 40-year-old is a different story as compared to a 30-year-old. 40-year-olds are the group most affected by delaying parenthood in the sense that their efforts to procreate are the most likely to fail. They do not have time to waste at clinics treating them as they do their younger patients because time is not on their side. A 40-year-old's first choice of clinic has a lot more riding on it. If a bad choice is made, then their chance of pregnancy with their own eggs may be forgone. So I hope these questions help you in your choice of clinic. Thanks for tuning in.
Thank you for watching Making Babies in Your 40s. Would love to know what you think and what you would like covered. Please leave your comments and subscribe to my channel. See you next time.